Okay, so welcome to week 4. This is actually session 7. So hopefully by this stage you've been completing online work and you've been reading through the course manual. We've got some good news that we'll actually be able to start doing practical training this weekend, and you guys will be on from 9:30 until about 11. So you'll need to bring gear to get in the water and get wet. So please dress accordingly. Please be here before 9:30 because there'll be a sign-on sheet in the clubhouse. We will sign you on. We'll allocate you to one of the trainers because we have to train in groups of 5, which will mean 1 trainer to 4 participants. And then we'll get down into the water and get going. Okay. Any questions about that? Excellent.
Right, so what day is it?
Saturday morning at 9:30 a.m. until about 11.
Okay.
Okay, so over to you, Gerard.
Denny, so we're just coming across okay. I'm all, you can hear me? Good. Okay, welcome once again, everyone, to the bronze training sessions here at Wanda. I hope that you're learning something. I hope that you're enjoying doing these sessions. And it's great news that we can get down to the beach. And I'll be looking forward to meeting you all once we all get together on Saturday at 9:30. We'll have the SRCs before then, all things being normal. And it'll be great to finally get back to our beach. Righto. So where are we up to in our training? Hopefully you just did the self-paced lesson. I'll hold it up for you. This is your learner guide. You should start to become familiar with this now. So it's session 6 was the self-paced resuscitation and rescue planning. Hopefully you've done that, because remember, as we go through the course, you will have to do that all completely to print a certificate, which tells us that you've completed the online component. So it makes a lot of sense that you do it as you go. And then when it's time, you just finish off the last one, print your certificate, and that comes along to assessment day. So that's where the online component of your learning gets involved in your assessment. We have to have that certificate that tells us you've done it. Okay, tonight we're going to look at rescue skills and resuscitation. So resuscitation, you've already done some of that, of course, in your SRC course, and also a bit of rescue skills you've done. But in education, sometimes things change. Sometimes they realize, oh, we could do things better. And so that's why we cover resuscitation again. And we're going to cover a few things in terms of rescue skills as well today. So you know that last season, they started a new course, both SRC and Bronze Medallion. So they're now giving you the opportunity of using the SRCs now have the opportunity to use radios, which they didn't have before. And so we expect that by the time you get in the bronze group, you're pretty good on the radio. You got some of that professional pro words down pat to get a really good message across to help the patrol captain understand exactly what's going on where you are. So tonight, signals, we won't do much with them at the moment, but surely you remember your signals in your learner guide. You will have that, of course. And remember, you will be assessed on those in a line, and the assessor will give you a signal and you'll have to perform the signal. Keep that in mind. We're going to mention the principles of a rescue as if you're on a roving patrol. We'll cover tube and board rescues. We'll briefly touch on rescues without equipment. Carries and drags, we just can't do much about that at the moment with the COVID restrictions, okay? But we'll just maybe look at a slide or two, just so you realise that if we do bring someone unconscious out of the water, how do we get them up the sand? There's nothing they can do, so we've got to carry them. The drag is for somebody who's covered in stingers. Now, it doesn't happen often here, except maybe with Ben, who got caught up with a fair bit of blue bottle tentacles on himself. But the drags are usually for people up in Queensland where they have some real nasty stingers. So rather than the lifesavers, get involved and grab the person around the body and therefore get the stingers too, the lifesavers will just drag them up the beach because they don't want to be in contact with that person while the tentacles are still on them. So that's why we have drags. Post-rescue operations, you have to fill in a bit of paperwork sometimes, especially if it's an important rescue and definitely a resus. And the next session will move on. So there's your mention of your signals, and that's how you'll be controlled during the assessment. Principles of rescue. Okay, remember this, maybe it's Ben, here's our little patrol scenario. If you can sweep over to that. Remember, we have 4 main call signs. I'll go over them quickly, but you should know these. There's the patrol tent. So if you want to contact that, typically the captain is there on the radio, and that's Wanda Patrol. There's the IRB, and so that's Wanda IRB. The tower, the lifeguard tower is Wanda Tower. And if you are roving either north or south, usually in a pair, then there's Wanda roving north and Wanda roving south. They are the 4 main call signs you will use. But just imagine that you are up here on your own. You're right near the limit of where we patrol, because we only go as far as track 8. That's the limit of our territory, if you like. What are you actually looking for? Now remember, and please keep this in mind whenever you're at the club, whenever you come here and you're on patrol, the reason why we are here is to watch the people in the water. I know we do a whole lot of other things here at the club, which is all a great lot of fun. And there's a lot of good things going on here. But please remember, the fundamental reason why the club is here is to ensure that people, and usually they're not as good in the water as us, ensure that they're safe. A lot of us are local. We've grown up with the beach. We know where the safe bits are to swim. We understand it all. We can spot a rip. But you'll get a lot of visitors here that don't have that knowledge and experience. And that's why we are here, because when we sign on to patrol, we're here to say, we're going to look out for you. We're going to make sure you're safe. That's our job as a lifesaver. So I hope you've done the online component, because I'm going to throw you some curly questions now, and I wonder if Denny could help. I'm going to throw the word at you, scanning the water to look at people and to see perhaps if anything's wrong. You've got to look first to see if everybody is perhaps between the flags where they're supposed to be, or if some are drifting. Although you use this also when you're out on your roving patrol. So Denny, could you ask them some of the different types of scanning? Let's just see their response.
Okay, so I'm just going to go through the people randomly and just tell me a type of scanning. So I'll start with you, Chelsea. What's a type of scanning?
Is it like that fixed focus stuff?
Fixed focus?
Possibly.
Possibly. Okay. India, what's a type of scanning?
I'm not sure.
Okay, that's okay. Has anybody got any feedback on what might be scanning?
Wide focus scanning.
Wide focus scanning. Okay. So we need to get a little bit more specific.
Is vertical tracking one?
Who is that?
Me.
Me.
Me, Emma. Well done, Emma. I'm looking at 16 names on the screen. I can't always tell who's talking. So well done, Emma. Okay, vertical scanning. If we've got vertical scanning, what's another type of scanning?
Horizontal.
Horizontal. Well done. Okay, what else have we got? What about grouping?
Right. And counting the numbers.
Mm-hmm.
Rightio, Denny. I'm going to come back to me if I could. So that tells me that I don't think too many people have done the online component in session 6 where they cover scanning, okay? What it's all about is to watch the people in the water and to have some method of assessing how they are going. So we scan the water, especially between the flags, because we need to watch in case they start to drift. And as you know, it's common that there can be rips on the side of the flags, and sometimes they just grab a few people that are in the flags and pull them sideways, and they could be in a rip. So that's why we're scanning the water, okay? Very important. So now we've got a bit of an idea of who's in the water. We start to put them into priority categories. Who is most at danger and who is least at danger? So generally speaking, the healthier, fit people, they can usually look after themselves, but the people that might get in trouble tend to be the smaller ones, little kids, especially if there's a shore dump, they can easily get rumbled by the waves. So little kids close to the shore, and especially if they start drifting out, well, you've got to watch them because they're not as strong. And old people, not as strong, not as fit, and they can also get into trouble. So we're starting to look at the water and work out, well, who might get in trouble out of who's there? Where is the area of most need, most risk? And that's why we start to scan. We might come back to that a bit later.
Let's take some answers there.
Yep.
So can everybody just shout out what they think might be a good thing to look out for what's a good indication somebody's not a strong swimmer? So I'll start with you, Alex. What's an indication somebody's not a strong swimmer?
You can kind of tell when, like, by their facial expressions or their body language.
Yeah, yep, that's a good one. Okay, Bronte, what's a good indication somebody might be a poor swimmer?
Struggling to keep above the water.
Yep, struggling in the water. Tara, what's another dead giveaway somebody's not going to be a good swimmer, even before they hit the water?
Well, I'm not sure about before the water, but I was thinking like hands waving out or to the sides.
Yep, that's okay. Okay, Violet, what's an indication that somebody's not going to be a good swimmer when they come to the beach?
Maybe they pick the wrong place to swim. That like.
Yeah, excellent. They've gone in where the rip is. Tali, what's a good indication that somebody's not going to be a good swimmer?
Like if they're wearing, like if they're going in fully clothed.
Yeah, absolutely, 100%. That's a really good one. Okay, Ava, have you got one for me?
That's what I was going to say.
Okay, that's all right. Okay, Amy, have you got one?
No, not that's already been said.
Okay, I'll try Ellie, and then we're done. Ellie, have you got an indication of somebody that might be a poor swimmer?
I was just going to say following what other people do.
Yeah, they're just going in where everybody else is going.
Yeah.
I'll tell you a good one that I saw one day. I was down here patrol. People going into the water when the beach is closed is a good indication that they're going to get in trouble. But I've got to say the funniest one was the guy who turned up with a brand new fish surfboard in the plastic from Rebel Sport, and he undid the plastic and came up to us and said, "Where's a good place to go?" He then put the leg rope on his wrist and in the water he went.
New board. First timer. Look out. Yeah. Well, so you certainly came to life on those questions with Denny. We'll work on the scanning perhaps another time. So Denny, do you think you've got that video of the distressed swimmer? Somebody said you look at their face. Now, for me as a patrol captain, that is the best indicator of whether somebody is distressed or not. You know, surely perhaps we have a bit of an idea of what is a worried look and what is a happy look. So distressed is important, but it's only effective when you are within about 60, 70 meters of the shore, or the swimmer is, because a little further out, it's hard to read what's going on in their face. But certainly closer to the shore, their facial expression is very important. And that'll tell you a lot. So Denny's just lining up this video. How's it shaping up there? He's looking good, righto. So I've got a distressed swimmer first. Drown, they're going to be shouting out. Well, not always. What is often what we call the mechanism of drowning is once they've bobbed down below the surface and they get a bit of salt water on their vocal cords, it can cause your vocal cords to tighten up. Now that's a problem, because if the vocal cords tighten up, it's hard to make a loud noise. It's very hard to make a loud noise because they're so tight. But the other problem is it blocks your airway. So they're struggling to get air in and they can't scream. They're on a hiding to nothing, as we say in the racing game. So a bit of salt water on the vocal cords, or if you start taking in salt water, it can really make things go downhill very quickly. So Denny, if you could just play that drowning video.
So we're seeing his head go up and down out of the water. He's having to tap the bottom to get his head above. His arms are flailing. And what you want to look for is an action that they refer to as climbing the ladder. So he's putting his hands above and then he's trying to pull himself up out of the water on an imaginary ladder.
They stopped it there because of that guy. He's gone for all money. Again, that's what we say in racing. It was over for him. Unless someone like us comes along and helps him, that guy's just going to stay on the bottom. So we've got to work out, therefore, who needs rescuing. And then we've got to make a decision about what we're going to do. Principles of rescue. Now, remember I said, we've got a uniform on, we have signed on, we are on patrol. We now have a duty of care, it's called. That's actually a legal term. We have a duty of care, a job, to make sure everyone is safer on the beach. So we've spotted our distressed swimmer on our roving patrol, and we've got to make a decision about whether we can do that rescue or we need some help. So what's one of the considerations you've got to make? Maybe I'll throw this one to Denny again. He's done this well before. So when you're about to decide, I'm going to do a rescue, there's a few things you've got to consider, and maybe we'll throw over to the group for some answers.
Okay, so what do we think might be the first thing we consider when we see somebody who's in trouble in the water? So I'll start at the top. Chelsea?
What equipment we have?
What equipment we have. Excellent. India?
How far out the swimmer is?
Yep. Alex?
Oh, can you repeat the question again, please?
The question is, when we see somebody in trouble, what are the first things we need to consider?
So
Chelsea said the equipment we have. India said how far out they
we
are.
need to consider who we could call to help with us.
Yeah, that's a good one. So who can we get support from? Bronte, what's another consideration before we head out to the water?
The state, like how they're acting.
Yeah, how they're acting. Yep. Tara, what do you think might be something that we need to look at before we go out in the water?
Like if they're unconscious or if their head is tilted back.
Yep. So how much trouble they're in. Okay, Violet, what's something that we need to consider?
Like the size of the person and what they're like, who they are.
Yep. So what you guys have all explained to me there is you're looking for danger, right? And as we get into our CPR component of the course, the first thing we're always looking for is danger. We're looking for danger to ourselves. we're looking for danger to the patient and we're looking for danger to the people around us. Okay, so that's really good. Okay, so what's next are we going to consider is we're going to, sorry, limitations. Okay, so if it's the middle of winter and I haven't been training and the person is 300 metres out to sea, is it a good idea for me to go for a swim? Probably not. Okay. What's the next thing? That'll do. Okay.
Righto. So very important that you decide on what sort of rescue you're going to do based on your equipment, but then you think of yourself, can I do what I'm thinking of doing? If not, you've got something with you. Remember this? Yeah, the radio. And you are another pair of eyes and ears on the beach to tell your patrol captain, to tell the lifeguards, but mainly you'll just report directly to your captain, and you can report exactly what's going on there because you're right on the spot. So don't think because you're young that you're not important in this whole thing. You're very important and you can offer a lot. And I'm sure that young people at times have saved lives. I've heard reports over the news that even nippers, they'd just be at a beach at times and just their nipper training was enough to help them do rescues. So please don't think you're not important. You've got a radio. If it's beyond you, then you can just inform the patrol captain. Don't think you have to necessarily do the rescue. If you think that between the two of you on your roving patrol, you're going to struggle, okay? Remember, danger to yourself, very important. Okay, so because we're going to get in the water on Saturday, I hope that we can all make it. I'm sure we're all keen. Denny's going to show us a pretty good video about the tube rescue first and then the board rescue. So this is to start getting you in that right frame of mind. What are we here to do with the tube and the board? We're going to show you a technique, and the trainers on the weekend will show you a technique about how to do it. So how are we looking there, Denny? We shaping up?
Yep, we're good to go.
Now remember, somebody said, what if the patient's unconscious? These first lot of rescues are just for a conscious patient. You may not be able to tell perhaps from the shore, I don't know, but what you do when you get there varies depending on whether they're conscious or unconscious. So this is a conscious patient tube rescue. Righto, Denny?
Okay, so what she's doing here is handing the person the tube, coming around behind the person, hooking the tube up to the ring on the back, and then first thing she's supposed to do is signal for help, but that's okay. She's fairly close to shore, and she's swam the person in, and now what she's going to do is protect the person from the crashing waves. Okay, and then just slowly walk them into shore.
So you could see that the girl there, lifesaver, was scanning the water at first, and then when she noticed something, she prompted her into action. You'll notice too that when she got near the patient, she didn't go straight up to the patient. She stopped a couple of meters short, and that's very important. I think you know why. Because if that patient's panicking, they can just start grabbing you. If they start grabbing you, although we have some releases, we call them some escapes and that, it's just better not to get in that situation. So for what we're going to do on our first wet session is stop short of the patient and slide the tube to them in the water. You don't throw it. We'll explain why on Saturday. And then once you get them hooked up and swim them ashore, they're your concern until they're safely back on the sand. And you've got to look after them. Remember, it's your job to look after the patient until they are safe again and they're removed from danger. So this time we're going to use a board to do a very similar thing. So this is a conscious board rescue. Oh, sorry. Just say it would be a bit further out.
So this would typically be where somebody's a little bit further out from shore. So all you guys, I'm sure, have paddled out a million times. We pull up beside them. We turn the board around so it's facing in towards the shore, and then we pull them onto the board. What we don't want to be is on the surf side of the patient, because if you get a dumper come in, it's going to pick the board up and put it on top of the person you're trying to rescue. And then just paddle in.
Rescues are typically beyond the break. If you watch Bondi Rescue, have you ever noticed that that's about the only bit of equipment they use as boards, apart from the jet ski? There's a reason for that. All those guys that they pick as lifeguards are really good on the board, and they can handle being in the break zone or in the surf zone with a patient and on the board. But generally, because you're starting out and you're small, typically you would do a board rescue beyond the surf zone when you're out the back. And it's kind of safer to put someone on the board out the back there, so there's no waves breaking on you. The key thing after that is just to balance the board. And so they're going to tell you all about that. You know that when you're on it yourself, you've got to balance it, especially when you're catching a wave. If you're too far in front, you end up nose diving. So now you've got someone on that board, and you've got to remember, they may not have been on a board before. They could be all fingers and thumbs, as we say. They could be very uncoordinated, and they're slipping off and they don't know how to hang on. You'll notice that rescuer, he actually got his chest over the bottom of the girl, because that kind of pins your patient down to the board, and you can feel their movements if they are going to slip off. Very important to get it properly balanced so that when you're going in, you're not going to go down the mine and nosedive in the break, or then you could be in more trouble. Okay, here's Denny once more.
Yeah, just a note for you guys, when you're on the rescue boards on the weekend, they're very different to the racing mals that you guys have been riding for the last year. They're a lot heavier and the balance is a lot different. You really do need to get all the way back on the board when you hop on a wave, otherwise there is a big chance you're going to go down the hole, which is a bad day for everybody during a rescue.
Yeah, very important. So it's interesting. Some of us say that using your racing mals, it's like a little sports car, but these rescue boards, they're like a bus. So you've got to get used to a whole new way of working. I'll test you out. Righto. It is possible to do some rescues without equipment, wrist toes and hip carries and things, but they're a lot more risky. It's the sort of thing you only do if you really have to and you're a strong swimmer. But we mention them because that's all part of the course content. We won't worry too much about them for now. The carries and drags, remember I mentioned this before, that imagine you've got an unconscious patient, you've just taken them out of the water. Yeah, thanks there, Ben. And if you look at this girl here, they've taken two people to carry her up the water. So typically that would be an unconscious patient because they can't walk up the sand themselves. And so one person has to get on the back with their trunk. So we call that the trunk. This person's on the legs. So that's the trunk and legs carry, which we typically do for an unconscious person. The other one is the armchair carry. So just go back a bit if you would there, Ben. And if two people get side by side and they hook their arms together, you've probably seen this done many times. And the patient sits on their arms, which are hooked together, and the patient is here with their arms around each of the lifesavers. So that's the conscious patient rescue, and that's the armchair carry. So remember, there's two carries, but we may not be able to do them during the restrictions, okay? And here's the stinger drag. So remember I mentioned it's normally the people up in Queensland where there's some really nasty stingers in the water, irukandjis and all sorts of gimbals and stuff like that. So the lifeguards there, they wear these full body suits to protect them. But in this case, they're just putting a bit of water, possibly vinegar on that. And the lifeguards there, they're going to minimize the contact with that person. They're just going to drag them up the beach until they can treat the person a bit better. So that's just a little snapshot of the carries and the drags. Normally, we would practice them. It will depend on the restrictions. Rightio. Okay, we've looked at those things. Duty of care, the main consider. We've done all of those, I think, Denny. That means that soon we can start our CPR, our resus planning. So I'm going to rewind back to the start of the PowerPoint presentation, and we're going to cover things a little differently. What we might do is give you a chance to get a pillow and a cushion. I'll show you mine, if that's all right, because here's the normal mannequin, and you're going to meet these guys when you come into the club. But where you are, you're going to have to use maybe some cushions as the body and the head. And so I'll give you a few minutes while I rewind the PowerPoint presentation. And if you could find some cushions similar to that, so it's like the body and the head of the mannequin, and we'll come back in a couple of minutes and we'll start a bit of CPR, okay? Okay.
Okay, so hopefully everybody's back. So what we're going to do to start with is we're going to watch a video, and then Gerard's going to do a demonstration and we'll take questions. And then what we'll do is hop into the breakout rooms and you guys can practice with each other, okay? So I'm going to put the video on now, and then we'll watch that, and then we'll come back to Gerard.
Can you hear me? Open your your eyes if you can hear me. What is your name?
Squeeze my hands if you can hear me.
Victim has no response. Send for help. We'll now assess the victim's airway. Applying pistol grip and looking into the mouth. Mouth is clear. Applying backward head tilt. Assessing the victim's airway. Airway is clear. We'll now assess the victim's breathing using look, listen, and feel. The victim is not breathing normally. We'll now commence CPR. 1, 2, 3, 4, 5, 10, 15, 20, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5.
Hey, I have a defib unit with me. Can you please confirm that the victim is not breathing and is not responsive?
Yes.
Okay, I'm going to apply the pads to the victim's chest.
1, 2, 3, 4, 5, 10. 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 10. 20. 5.
Okay, analysing. Do not touch the victim. Shock is advised. Please stand clear of the victim. Delivering the shock now. Shock delivered. It is now safe to touch the victim and continue CPR.
The victim is showing signs of life and is breathing normally.
We'll now roll the victim onto their side into the recovery position using the hip and shoulder roll. One, two, three. We'll now monitor the patient's vital signs until emergency services arrive.
Well, that team of people were pretty well rehearsed. We just got an echo coming through there, Denny. And he's onto it straight away. Well done. Thanks, Denny. Doing a great job. So imagine if we could get to that point here at Wanda that we can just go through the whole routine so well. They were well trained, those people there. But with a bit of practice, it's not hard to get to that point. You got to make sure you're not panicking, you're thinking clearly, and then you're thinking about all the steps that you've done with your training at the club. So the few things that you will have to do apart from the whole CPR is you will have to, as part of your assessment, because they had a successful resuscitation. So remember they said patient is breathing normally. They had to put him into the recovery position and they had to show the correct use of the defib. These are all things that you have to do as part of the assessment, apart from all the other things. So there's little things in that particular video, and that's the latest one they've made to show all the components that will be in the assessment. So there's a lot of detail in that as well. That's what I'm trying to say at the moment anyway. So let's go back to our DRSABCD. That's called an acronym. A whole bunch of letters that all stand for something and mean something. I'll talk you through it and then you'll go to the pillows. I'll try not to overload you with too much information. Just pick up what you can. You're going to hear this acronym quite a bit at the surf club. But then the more, I've done it 1,000 times, but the more you do it, the better you get at it. So D is for danger. Do you remember in the video, you saw the guy, he already had his gloves on and he checked for danger. So it's a good thing to show some sort of movement that prompts you. I'm checking that the patient is clear and there is no danger to myself, to anyone that's here, or any further danger to the patient. If the patient is in a dangerous situation, like maybe there's a snake there. We do get snakes in the sand dunes here, just next to the clubhouse. Just say there was a snake there, you wouldn't go charging in. You would sort out the snake first before you start treating the patient. So D for danger to yourself, the patient, and bystanders around. Check that the scene is safe. Next thing that we do, if it's safe to get near the patient, we can do a response. Sorry, Ben, I should go to this one first and then I'll demonstrate on the pillows. And you saw what they did. They used another acronym called COWS, C-O-W-S. And it's a good one to remember because the 4 words or the 4 phrases, can you hear me? Open your eyes. What's your name? And squeeze both my hands. This is a way for trying to find out the state of consciousness of our patient. They could just be asleep on the beach and you've stumbled across them and you're acting like they're in trouble. Well, if we do that, give them a bit of a niggle there on the neck, bit of a squeeze, we ask them what's their name, etc. If they're just having a sleep, well, they're going to wake up and tell us. But you'll find in that particular video, the patient was unresponsive. So that's important. Nothing happened as far as the patient is concerned. That means they're unconscious at least, and it could be worse. So we've got to do further checks. R for their response. If we get no response, and therefore the patient being unresponsive is unconscious, we've got to get some help for this person and for us too. So on your roving patrol, it's straight onto the radio and to go through the 4 Ps to your patrol captain. We won't go through them now, but you request help. DR, I always test myself. DR, doctors, DR, you know, doctor is DR, doctors must be DRS. We've sent for help because our patient is unresponsive. DRS, what's the next letter? Must be A for airway. Airway, the patient's airway. The airway, well, air can come in both through the nose and the mouth, and then it goes down a tube here and into their lungs. But the only part of the airway that we can inspect is basically the mouth. So you'll see on the video with the pistol grip on the chin and a bit of head tilt, we open the mouth to see if it's clear. And that's about as good as we can do as far as checking the airway goes. So I'll just get you to do this. If you could hand back then. Show me a pistol grip. So see how your 3 fingers curl up there and it's like a gun, pistol grip, and grip your own chin. And it's important that these 3 fingers curl up out of the way, that they're not touching your throat. The 4-finger comes around your chin and the thumb goes just under your lip, your bottom lip, okay? There you go. So you've got to be able to do that. Do that on yourself and make sure the fingers aren't touching your throat, fingers wrapped around, thumbs below your lip, and you've got control of that patient's lower jaw. They all doing that well, Ben? Denny, sorry?
Yep.
Good, okay. So a good pistol grip gives you control of the patient's lower jaw so you can check the airways. A for airways. A, what's, Ben, help me, mate. What's next after A? Oh, I knew I could rely on Ben. A, B for, what is it for? Breathing. B for breathing. How do we know if someone's breathing? I'm going to give you the short answer. The chest is the most important thing to look at, to work out if they're breathing, because that's where the lungs are. And if that's going up and down, then they're breathing. So we use 3 words. Look for the rise and fall of the chest. listen for the sound of them breathing and feel their breath on your cheek. So as you're looking to the chest, you're listening for the sound of them breathing, and you want to feel their breath on your cheek. 3 ways of doing it. Now in the video, as always happens in these training videos, there was no breathing. So we've got to keep going down the list. B, R, D, R, S, A, B. Next one is C. We must start CPR on this patient. Now, you will be doing resuscitation in pairs. So it's called a 2-person CPR. These are in the mini first aid kits, or what we call the bum bags. It's a mouth mask. So with that in place, one person will start with 2 breaths, and the other person will begin the compressions on the center of the chest. The way we estimate it, we simply just look at the chest and we think that's the center, that's where I'm going to press. Away we go with some good compressions. Straight arms, so that all that strength and power is coming straight through your shoulder and into the chest, because it could be a pretty big guy and he's got a hard, big chest, and you've got to push it in a third the depth of his body. So if you think of his body being so thick, then you've got to get a third of the way down with your compressions. See my arms nice and straight? You can hook your fingers like that. Some people hook their wrist. As long as the heel of your hand is right in that center bit. You're giving it a really good press. Because what you're doing is artificially making that heart beat, because this person, their heart stopped. We know that their heart has stopped because they have stopped breathing. And that's what we use as a sign to tell us that somebody's heart has stopped. We simply look at their breathing. If their breathing's not there, start CPR. Their heart has stopped. So a couple of figures, and you'll hear these a lot, and I'll try not to bamboozle you with all these figures, but we do 2 breaths to every 30 compressions. So there's a table coming up in the slides, 2 breaths and 30 compressions. We usually count them out, 1, 2, 3, 4. You heard that on the video. 27, 28, 29, 30. If I was doing it on myself, I would do 1, 2, and then 30 compressions. This is 1-person CPR. Actually did this once. I think I told you that last week. It actually worked. Breath. And looking at the chest to see that it's falling in between the breaths, because that tells me that I'm getting air into their lungs effectively. And back to our compressions. So 2 breaths, 30 compressions, a third the depth of the chest is how far we go down. And the speed or the rate at which we do those compressions, we say is 100 to 120 compressions a minute. So that's about that speed. I'm having a bit of a guess there, but I know, because I'm a little bit musical, that's about 100 to 120 beats per minute, compressions a minute. Now, just say it works. Well, that's what happened in the video, but they used a defib, because the defib can start that heart again if it's got what's called, here's another one of those big terms, if it's got a shockable rhythm. Now that means if the heart is just sort of quivering and it's what's called fibrillating, then the defibrillator can get their heart going again. So they put the pads on here and there, and that's what everyone was doing. The defibrillator gave the victim a shock, and lo and behold, it worked. The patient started breathing because they began to move. They could tell the chest was rising and falling. And so they put him in the recovery position and monitored the patient until the ambulance got there. So the patient's still not out of the woods, as we say. They still might have another setback. It has been that once somebody has been revived, Oh, their heart stopped again. Oh, we had to do it all again. You know, some people have had the defibrillator shock up to about 15 times. I heard of an instance where somebody had the shock about 18 times and the people said, what's the point? Just give up. And someone said, no, do it one more time. And they did it one more time and it worked. So the important part of that little story is try never to give up. You're not supposed to, only unless you're just so exhausted that you can't do anything. Anyhow, we'll talk more about that. I think you've had enough information for now. We're just going to start then with the basics in CPR. So hopefully you've got a DRSABCD in front of you. That's the one from the learner guide there. It's always the same. It's got the steps. So you'll be doing it on your pillows. You'll be approaching the scene. Check for danger to yourself, bystanders, others. Check for a response from the patient to determine if they are conscious or not. R, S is send for help. What we might do in terms of sending for help is do a radio message. See if you can think of the 4 Ps. Check the airway. So you've got to get down and look at the chest. Look, listen, and feel. Assume that, sorry, I just mixed that up. A for airway, that's right. I did that to test you, okay? A for airway is the pistol grip and the hand on the forehead to open the mouth and check their mouth is clear. If it's not clear, by the way, you roll them over and scoop with your finger anything that's in their mouth out of it. Put them back. The airway's clear, then we check for their breathing. Assume they are not breathing. We've looked, listened, and felt, and there's no rise and fall of the chest. And so begin CPR. C is 2 breaths and 30 compressions. And then you're on your own, but what will happen in your training is someone will come along with a defibrillator. You'll keep working until they get it set up. They'll put the pads on. You keep working while they're putting the pads on. And then eventually they'll say, don't touch the patient. And the defibrillator, there's a little voice in there, tells you what to do. So you keep working until that defibrillator comes in, is placed on, and it starts telling you what to do. If the person doesn't come back, you continue CPR and the defibrillator will tell you that. So do you think you're ready to do that now?
What I was going to suggest is maybe you just do it from start to finish.
Yep.
Without the instructions for them to watch.
Yep.
Talk your way through it, and then we'll get them to go online and try and get the breakout.
Sure. Will I do it on the cushions, Denny, or on?
Do it on the cushions so they can watch what you're doing there.
Okay.
And remember, they can't see what you're doing when your hat's on.
Oh, my hair is an absolute fright at the moment because I haven't got a barber that I can go to. So that's why I wear a hat. It's a mess. It was never good to start with. Okay, so we're good to go, Denny? Rightio. So I'm going to try and do what that guy in the video did. Okay. He approached the scene. He saw somebody lying there motionless. Check for danger. His gloves are on. It is clear for person, the bystanders, and the patient. D, R, response. Can you hear me? Open your eyes. What's your name? Squeeze both my hands. No response. Patient is unresponsive. Send for help. Wanda Patrol, Wanda Patrol. This is Wanda Roving North. We are 200 metres north of the flags. We have a patient who is unresponsive. It's a male, 15 years old. Could you please send some help? The resus kit would be good. This is Wanda Roving North clear. So that's our send for help with the 4 Ps. DRSA, airway, pistol grip. Mouth is clear. If mouth wasn't clear, we would roll and clear the mouth with our finger or one of their fingers. You can use their finger. You don't want to get yours yucky. Airway is clear. Breathing, B. Look, listen and feel for the rise and fall of the chest. look at the chest, listen, and feel their breath on your cheek. No breathing. Therefore, assume the heart has stopped. We must then proceed with CPR. 2 breaths. 1, 2. Compressions. Can anyone remember the compressions that I do, the rate and the ratio? 2 breaths to how many compressions? I assume you said...
Jump in. 30.
I'm sure I heard 30 there.
30 compressions to 100 to 120 beats a minute.
Right. 2 breaths. 30. You've got to go through this 5 times at least in your assessment. At least. 30. Breath. Now, while this is happening, the person with the defibrillator turns up and attaches it to the patient's chest. Doesn't mean you stop, keep going. The defibrillator's now placed on the patient's chest. Oh, 27, 28, 29, 30. Now, the defibrillator says, no one should touch the patient. Analyzing. Off we come. Shock advised. Press the orange flashing button now. If it's successful, it will tell you because the defib knows if the patient's heart is beating. If it's not, it will say, continue CPR, etc., etc. And that's the state that you have to get to in your assessment. The assessor may say continue CPR, or they may say patient starts breathing. They usually, I'll give you a tip, they often say patient starts vomiting. There's a curly one. Think about that. If the patient starts vomiting, is that good or bad? I wonder. What do you think? Patients. I think it's great. I think it's marvelous, considering they were just half dead a minute ago. Anyhow, it means they've come back. So that's why vomiting is a good sign. You just put them in the recovery position, away you go. Okay, that's enough from me. You're going to have a try at that. Try and remember DRS ABCD. It's good to have that chart out to remind you. But if you haven't got it, just do the best that you can. And it's up there on the things if that's coming over. So we're going to go over to Denny into the breakout rooms, I believe.
Okay, so we're going to do the breakout rooms. Guys, you really need to put your cameras on because we can't help you if we can't see you. So when you go into the breakout rooms with your partner, get your cameras on and take turns at doing it. Don't worry if you're not getting it perfect, just do your best, okay? So we'll probably spend about 5-10 minutes in the breakout rooms and then we'll finish up for the evening, okay? Let's go. everyone's good.
Yeah. Okay. So what's happening next and next week?
Okay, so let's focus on Saturday.
Oh, they're finished, are they?
Yep.
Oh, okay. You didn't do a final see you later.
Oh, no, everybody's still here.
Oh, right.
Yeah, sorry, we haven't got calls. Yeah, so
Okay.
finishing up for tonight, focus on Saturday, and we'll work out what we're doing next Wednesday night as restrictions ease.
Okay, so we'll be in touch with an email. Okay, so keep that in mind. We'll be in touch with an email, but we hope to see as many of you as possible here on Saturday morning at 9:30. Okay, they tell me the water's cold, so if you feel the cold, make sure you bring a good wetsuit. And we're going to do run, swim, run, tube rescues, and board rescues. They're the three things. We may or may not do spinal yet for you guys. We'll see.
I'd like to get them on a mannequin.
All right.
So they can get a real feel of it.
Oh, you mean resus? I was thinking spinal, wet spinal.
Yeah, no. Yeah, we'll probably knock spinal on the head until next week.
Okay, so we might even come inside and do a bit of resus.
Yeah.
There you go. You've got it from Denny, the producer. So we may come inside, do a bit of resus on the mannequins first, and then outside in the water, run, swim, run, tube, and board rescues. Okay. Right, yeah. Well, that's all from me. So Denny, if you can wind up, if you would, and last word from Denny.
Okay, guys, thank you very much for your attention tonight. You're all doing okay, and we'll see you at the beach at Wanda on Saturday morning at 9:30. If you've got any questions, either ask them now or hit me up on email. Is there anybody who lives outside of the LGA who won't be able to come on Saturday? Also let me know and we'll see what we can do for you. Okay? Thanks, everyone. Have a good night.
Thank you.
Thank you.
Thank you.
Thank you.